Mrs. Charles, I see that you brought your weight-bearing precautions with you. If you need help with them, we can review with the doctor.
Welcome, everyone. Thanks for being here today. We're here to discuss the discharge status of Ms. Charles. Welcome, Ms. Charles. Welcome, Renee.
Hi. Hello.
So let's get started with some basic information. Ms. Charles is 67 years old, and she was admitted on March 4th. For her status, we're currently at post-surgery after a right ankle fracture, and we scheduled her first assessment on March 11th. Anna, please include the risk for readmission admission evaluation score when you update the team.
Well, certainly. Hello. Miss Charles had a surgical repair for her right ankle fracture. She is non-weight bearing, right lower extremity, has drainage from her wound, and also has a history of falls. Her past medical history is significant for arthritis, diabetes, and diabetic retinopathy. I'm going to check my notes, but I believe, yes, she's had some chest congestion and is not eating well. For example, less than 50%. Otherwise, her vital signs are stable. Please note that she was hospitalized for 5 days and was on more than 7 medications. Ms. Charles has had 2 emergency visits in the past 6 months, and she'll be going home on Coumadin. She has a high risk for hospital readmission with a score of 14. Both Ms. Charles and her daughter Renee are very engaged with her care.
I'd like to stress, my mother has been in a lot of pain that we haven't been able to manage. Getting outside is good for her. It gets her mind off the pain and reduces some of the depression. We'd like to get her out into her flower garden and take walks with her dog, Bugsy.
I see, and thank you for that, Renee. Let me also mention that anytime you want to input your feedback, it's welcome here. To begin, let's look at the medications. I see that Ms. Charles is on scheduled pain medication, but let's change that to a stronger pain medication, say every 6 hours is needed. Let's keep her on Colace to prevent any constipation that may result from pain medication. In addition, Ms. Charles is on anti-anxiety medication, which can cause falls, which we noted earlier. So we probably want to reevaluate the need for this medication as well.
Okay.
Please don't take my medication away from me. I get nervous and shaky when I don't take them, and it's hard for me to move around when I don't have my anti-anxiety medication.
I totally understand, Ms. Charles, and you needn't worry. We are here. We're going to do everything we can to facilitate your progress. And feel free to let us know how the medication is affecting you, because we need to know that in order to move forward. Okay. Let's see. Lana, could you please note Ms. Charles' concerns in reference to that in the file? And Anna, in addition, Ms. Charles is also on levothyroxine, so we need to get a THS level as well.
Okay, her TSH was drawn on the 9th of March, and it was 0.2. She has an appointment with Dr. Ramesh to evaluate her anti-anxiety medication.
Thank you, Anna. And Andy, can you please share your notes with the rest of us as well?
Absolutely. Mrs. Charles is in PT and she's doing very well. She has good bilateral upper extremity and good left lower extremity strength. Her transfers are supervision to contact guard. She's ambulating about 10 to 15 feet with a rolling walker min assist. She is non-weight bearing on the right lower extremity.
And I'm looking forward to using my walker again. It allows me to get out of my room, to see people, and even to venture outside for some fresh air. The restriction on my walking really limits me.
And I'm able to assist whenever I can, when the doctor modifies the weight-bearing restrictions.
Well, thank you, Renee, and thank you, Mrs. Charles. That's great to know whenever we're planning your discharge.
Okay.
Lana, can you please take note? To continue, her target MBI score is a 75 for this setting, and her current MBI is a 60. She is cognitively intact and independent with her feeding, independent with her bed mobility, setup assist, and her upper body ADLs, which is hygiene, bathing, dressing. They're all at a supervision to setup assist level. Her lower body ADLs are Min Assist, and she's also Min Assist with toileting.
That's an important point, Andy. Cognitively, she does very well. Her mind is active, and she tries to stay as busy as possible, physically and mentally.
Once again, let's mark that in our notes that these are important recommendations to consider. She's non-weight bearing on the right lower extremity following her ankle fracture, and ORIF, which is an open reduction and internal fixation. For repair and prior level to function, she was living independently in a 1-story home with 2 steps to enter. We are working to discharge her at the highest functioning level due to her engagement.
Good, good. Thank you, Andy. Anna, it was noted that she also went to the ortho yesterday for a draining wound, correct?
Yes.
Does she also have a follow-up ortho consult regarding weight-bearing status?
Yes, she has one in 3 weeks.
Okay, good. She does live by herself, and Renee has indicated that she's not always available during the day because you do work, correct?
That's correct. It's just during the day, so we're able to help out every once in a while when we're able to take off work.
So essentially, she does need to be independent when she returns home by herself. We can also identify some community resources that will be able to provide assistance on the days that you're unavailable. Okay. Would you like us to introduce you to Home Health Services and what they provide?
Sure, we'd be interested in those services.
Miss Charles, what type of dog is Bugsy?
It's a toy poodle.
Welcome, Margot. Margot, you know everyone at the table here, but I'd like to
Hello,
introduce
everyone.
you to Miss Charles and her daughter Renee.
Hi, Mrs. Charles. Nice to
Hi.
meet you. Hi, Renee. Nice to meet you. Hello, everyone.
And Margot is from Home Health Services.
I understand you're talking about transition, possibly going home. Is that true? Great. Well, I'm here to talk to you about the Medicare home health benefit. So I'd like to give you a little bit of the details about that first. Is that okay? Okay. Great. So the home health benefit is a Medicare Part A benefit that is covered, supports having skilled nursing services, possibly occupational therapy, physical therapy, and speech therapy services. It also has the potential to provide a home health aid that might be able to help, for instance, helping you get in and out of a bathtub or a shower, maybe help you with dressing. So it's kind of the details of the benefit. Before I go on, I kind of would like to hear a little bit about how you're doing and what some of your challenges are. Is that okay? Okay. I understand you have some challenges with walking. Is that right?
Yes.
Okay. Can you either tell me or Andy tell me what your challenges are right now?
Yes, she is continuing to make progress with her PT and OT. However, she does have non-weight bearing of the right lower extremity due to an ankle fracture.
Oh, great. Okay. And I understand you're making progress with occupational therapy and physical therapy, but you still need that. There's still potential for improvement.
Correct. Yes.
Okay. And is there a follow-up appointment for your fracture of your right lower extremity?
Yes, in about, I think, 2 weeks.
2 weeks.
2 to 3 weeks.
Great. Okay. So hearing all that information, it would qualify you for the home health benefit. And, with that weight-bearing restriction, that pretty much puts you into a situation where it would be difficult to leave your home. Is that correct?
Yes.
Okay. So that, again, just supports the fact that you would meet that requirement. Are you interested in home health?
Yes,
Yeah, that would be
Oh,
good.
great.
definitely.
Great.
Thank you, Margot. We'll let you know when the final decision is made.
Great. Thank you for allowing me to visit today.
Thank you.
And also, billing has informed me that Ms. Charles has Medicare with a secondary private insurance policy. She has 92 Medicare days remaining as long as she remains at a skilled level. So I think that concludes our meeting for today. Thank you all for attending. Thank you, Ms. Charles. Thank you, Renee. We'll weigh the information that was discussed today, and we'll reconvene in a couple days. All right?
Sounds good.
Thank you, everyone.
Thank you.